Okay, this is Brittany Burke presenting on substance abuse in rural areas. So substance abuse is the use of a mood or behavior altering substance. So this can be prescription drugs, this can be illicit drugs, this can be alcohol, resulting in significant impairment or distress. Substances misused in rural communities tend to be prescription medications, over-the-counter medications, alcohol, tobacco, and illicit substances. Prolonged use of these drugs can result in addiction, a chronic condition of the brain that can affect a person's physical health as well as mental health. Drug abuse and addiction affect not only the individual, but the individual's person's family and the community as well. Some signs of substance abuse tend to be lack of motivation, neglect of children or household, car accidents, interference with sleeping or eating, which can lead to general changes in overall attitude as well. So now that we've defined the problem a little bit, we'll talk about the scope of the problem. And these have been taken directly from the Healthy People 2020 report. According to the report, substance abuse continues to be one of the leading health indicators for the nation. It highlights some astounding statistics from the report as well, citing that rural women report more frequent use of cocaine abuse than rural men, and that alcohol and drug abuse varies by race and ethnicity as well. And another thing that it highlights is that there's been an increase in the prevalence of drug abuse in the last few years, including prescription opioids as well. And the result of all this has been that the number of prescription-related overdose deaths are starting to outnumber the overdose deaths of illicit drugs combined. So really briefly, we'll go through the Healthy People 2020 initiatives. So the goals that they would like to achieve as far as combating substance abuse in the rural counties. So they would like to reduce the proportion of adolescents who report riding with an impaired driver in the last 30 days. Increasing the proportion of adolescents reporting to never have used substances. Increasing the proportion of adolescents who disapprove of substance abuse. And increasing the proportion of adolescents who perceive a risk associated with substance abuse. So who look at substance abuse as something that's risky, a risky behavior and undesirable. Some of the other goals include increasing the number of admissions into treatment programs for IV drug use, increasing the number of treatment centers in rural communities that use the SBI screening tool to screen for drug use, reducing drug-induced deaths, reducing past month use of illicit substances, and reducing the proportion of people who engage in binge drinking with alcoholic beverages. Another goal is to reduce the average annual consumption of alcohol, reducing the rate of impaired driving, impaired being defined as a blood alcohol content of 0.08 or higher, reducing the use within the past year of prescription drugs, and reducing the number of deaths attributed to alcohol as well. So something that they're finding is the major problem with trying to combat substance abuse is access to substance abuse services, to both prevention and treatment services. So what they're finding is that less than 10% of people with a substance abuse disorder have gotten treatment within the last year. and less than 15% have gotten treatment within at all, ever. So what we're seeing is that, unfortunately, compliance with treatment is overall low amongst rural residents. And the primary reason for this is issues of access. So there's a variety of issues, barriers to access. So we'll really briefly talk about those. And a couple of studies that I found talked a little bit about the different barriers to access. One study was categorized the barriers into 5 groups. So geographical, organizational, economic, social, and psychological. And many of the barriers that we'll talk about today will fall into those 5 categories. Specifically, one study which did interviews with women in rural areas cited lack of transportation and social stigma as the major barriers to access for many women in rural areas as well. So what we're seeing is that over the last 20 years, there's been less farming, manufacturing, and warehousing jobs, which is the main mainstay for the community as far as the workforce. Many people, because those jobs are starting to become rare, are having to take jobs with lower wages or part-time jobs that don't have health insurance. So what's happening is the educated people are leaving the community, and what they're leaving behind are people, the elderly people in poverty, and the people that are sick as well. So even in areas that haven't seen sustained declines, such as the agricultural powerhouse in San Joaquin Valley, something as natural as a crop damaging freeze can plunge residents into economic crisis. Or not having enough money as well can even put people at an increased risk for substance abuse. Another barrier to access is the influx of drugs that we're seeing in rural areas. So what's happening is the manufacturers of drugs are starting to come to the smaller, more isolated rural areas to make their drugs in an effort to hide their labs. And so that's increasing the availability of drugs as well, and can also be a barrier to treatment. If you're trying to get help for an addiction and you're constantly being bombarded with opportunities for relapse, it makes it a lot harder to adhere to the treatment. Another thing with rural counties is there are limited treatment options. Many times there aren't very many treatment facilities in rural areas. And on top of that, there's not very many substance abuse experts in rural areas as well. So we're lacking facilities and staffs right off the bat. And then even those places that have facilities and have staff, they don't have the funds to maintain that staff full time. So even though there might be programs available, many times the programs aren't available on a regular basis or often enough for there to make a big difference within the community. And so with all of those barriers, logistical difficulties is also a barrier. So even if you have programs and you have staff and you're able to offer programs Monday through Friday or a good number of days out of the week, there's logistical difficulties. Many times, even when treatment's available, rural residents might not be able to get there. So many times they don't have driver's licenses, or they don't have reliable vehicles, or can't afford gas or insurance. So it's difficult for them to physically get to the program or the prevention program or the treatment service. Lack of affordable childcare can also be an issue for many residents as well. Stigma is a big issue, especially in the rural communities. It's probably even a bigger issue in the rural communities, seeing as these communities are smaller and more tight-knit. So in a lot of cases, you're seeing situations where everyone knows everyone, and there are no secrets within the community. And that can be make people more reluctant to seek help. Another thing that may make them reluctant is just going against that culture of individualism and self-sufficiency. Going outside that box and actually getting treatment, which is unusual for many rural residents. Prevalence of substance abuse in rural communities, unfortunately, is exacerbated by mental illness. Rural residents that battle mental illness are even at a increased risk. So in one study, which was a cross-sectional study involving over 1,500 residents in a rural community, they categorized the participants based on their psychiatric problems and their substance abuse history. So the categories were those with a current substance abuse problem, those with a history of substance abuse but no current problem, and those with no history of substance abuse. And what they found was that rural residents with a current substance abuse problem were the younger individuals, and these younger individuals that had the current problem tended to also have more psychological issues as well. Another study looked at schizophrenia and substance abuse in rural areas. In this particular study, what they found a variety of different results, and it kind of depended on who was doing the study. But you can kind of see the pattern as far as increased rates of alcohol and stimulant abuse among schizophrenic individuals in rural counties. And something these studies did control for was methods of assessing substance abuse. So these increases that they're seeing weren't because we've gotten better at assessing substance abuse or defining substance abuse. They're actually true increases is what we're seeing. So some current interventions that are out there, the Clearfield-Jefferson Drug and Alcohol Commission and the Clearfield-Jefferson Hepatitis C and Substance Abuse Expansion Project, which is located in Pennsylvania, and this basically aims to increase the services for those who abuse substances or those that are at high risk for developing hepatitis C. So this project uses the SBIRT primary care model to provide early intervention and treatment services for people with substance abuse disorders or at risk for substance abuse disorders. And it does that by providing interventions in multiple settings, such as hospital emergency rooms, trauma centers, and community settings as well, so that we're able to reach a greater population. This particular program oversees the development and implementation of the systems of services and also emphasizes increased awareness of the risk associated with substance abuse as well. The second intervention is the Nurse Navigator and Recovery Specialist Outreach Program, which addresses those with physical and behavioral issues that have issues with substance abuse. So what they do is they pair substance abusers with a case manager who is available whenever they need and can answer any of their questions, and also acts as a liaison between various health, human, and social services organizations. And then we have the peer-to-peer telemedicine network, which seeks to improve rural mental access using telemedicine networks. And so telemedicine networks it incorporates a number of applications like video conferencing, email, smartphones, and things like that to improve a patient's clinical access. And the nice thing about this is that it's with its ability, it's useful because it can extend care to those who live in remote areas. So the overall goal of the peer-to-peer telemedicine network is to increase the number of necessary mental health services for rural community patients. And then we have some other programs that are more community-based as well. So the Drug Abuse Resistance Education Program, which is something that I actually was involved in middle school. And this is something that they bring into the school, so it's aimed at the adolescents to teach them good decision-making skills and how to recognize the influences of peer pressure as it relates to substance abuse. The National Institute on Drug Abuse is a website that lists different materials that adults can use to facilitate prevention activities and educate adolescents as well. And then finally, the Underage Drinking Enforcement Training Center, which works to support and improve the ability of states and communities to enforce underage drinking laws. So definitely prevention programs can help control substance abuse in rural communities, particularly focusing on adolescents, like the DARE program and the NIDA program as well.